Hi, I'm Dr. James Meschino. What are the nutritional remedies that have been shown to be helpful for PMS or premenstrual syndrome? Well, of course, PMS is this, variable cluster of symptoms that some women get about 7 to 14 days prior to menstruation, and then often it disappears with the menstrual flow, but some women actually get dysmenorrhea as well, where they get very painful menstrual cramps. This is common, of course. About 1/3 of women who are premenopausal suffer from, some severity of PMS. Usually between the age of 25 and 40, it's at its worst. And, about 10% of women have really severe PMS symptoms. And the symptoms can vary, of course. There can have some emotional-based symptoms where you feel nervous or anxious or depressed or irritable, or there's more fatigue or lethargy, during that time of the month. Or you can get gastrointestinal symptoms as well, where you're getting abdominal bloating, which is very common. Cravings for sugar or chocolate, also reported quite often, and also alternating constipation, diarrhea. You can get breast tenderness, breast swelling, of course, menstrual cramps that we talked about. Some physical ailments, backache, headache, skin lesions, swelling of, your fingers and ankles. So not every woman gets all of the symptoms, but many women get some combination of those symptoms. So what's causing it? One of the the common factors in behind the scenes that you see that's fairly consistent in women that have PMS is a very high estrogen to low progesterone ratio. So they have too much estrogen, not enough progesterone. How does that happen? Well, it can happen from faulty dietary behaviors, which can raise your estrogen levels, or your liver's not detoxifying estrogen fast enough. Or sometimes there's sort of failure in the ovaries to produce enough progesterone from what's called the corpus luteum. But anyway, what we know is that estrogen to progesterone imbalance creates a lot of problems for different systems. It can lower endorphin levels in the brain. And when that happens, there's going to be mood swings and depression and anxiety, and you're just not going to feel the same. That imbalance can also lead to an increased secretion of prolactin, which is another hormone, which is linked to fibrocystic breast disease and sort of breast tenderness and swelling. Also, the high levels of estrogen can increase the release of aldosterone, which retains sodium and water. A lot of the bloating and swelling and water retention comes from that effect. So that estrogen to progesterone balance is, when that's out or when it's imbalanced, then you're getting these secondary spillover effects that sort of account for a lot of the symptoms of PMS. The truth is that there's some nutritional management that can actually bring the estrogen to progesterone balance back to where it ought to be. These are proven strategies that women have used, published in medical and other scientific journals to show the value. So what are the nutritional strategies you should be implementing? Well, you should be using a low animal fat, high fiber diet because that will reduce the amount of circulating estrogen. In fact, a low fat diet alone has been shown to relieve PMS symptoms in a large number of women. In fact, women, if they lower their fat intake from 40% calories as fat from their diet down to 25%, and they increase their fiber from 12 grams up to 40 grams a day, you see a 36% drop in estrogen, and that brings the estrogen to progesterone ratio back to where you want it. We have further proof of this because vegetarian women who have more dietary fiber in their diet excrete 2 to 3 times more estrogen from their body, and they have estrogen levels that are 50% lower than meat eaters as a general rule. And there's other nutrition and lifestyle changes that should also be part of this. You should not smoke. Smoking makes the problem worse. Within 2 weeks prior to menstruation, you should cut back on your caffeine and alcohol consumption. That often helps as well. Get enough rest and find a way to manage stress. Keep your stress hormones down, whether it's yoga, tai chi, working out, spending more time on pleasure-giving hobbies, things you enjoy doing. And the other thing that's really critical is that there are some very key supplements, both vitamins, minerals, and some herbal things that have been proven to be highly effective. But you have to know the exact dose, and in the case of herbs, you also have to know the standardized grade. So what I've done is I've put the whole lifestyle management program for PMS into an ebook called The Natural Management of PMS. You should download it right now. It's available right here. The reason you should download is because most medical doctors don't study nutrition, exercise physiology, herbal medicine. It's not part of the medical curriculum to any significant degree. So doctors are more inclined to write prescriptions for oral contraceptives, diuretics, antidepressants, painkillers, muscle relaxants, just to manage the symptoms. But to try to get to the root of the problem, you need the right nutrition and lifestyle management program. And so that I've provided that for you. That ebook called The Natural Management of Menopause, Natural Management of PMS rather, is something you should download right away if you have PMS symptoms. Now, Meschinohealth.com, you'll see my other research review papers. You'll see other videos I've created, footage from my live academic seminars, other downloads, resources I've created. They're all there for free to help you manage yourself in a way where you have a long, healthy, functional life. All my research review papers and my teaching materials come complete with all the scientific references, so you know you're getting only sound scientific information on any health topic that you're looking for. So you really should make Meschinohealth.com an ongoing, reliable resource when it comes to health and wellness information, if you're looking for information yourself or if you need information for a family member. Thanks so much for watching.